Soft tissue fillers are things that can be used to fill up areas of the face in general that are either lacking volume congenitally, or that's just how you were born and that's how you look, or need volume that has been lost over time from what's known as fat atrophy. As we age, the amount of fat that we have in our soft tissue, depending on the genetics of the patient and the exposure they've had to sunlight and other factors, tends to slowly go away, and we also use soft tissue fillers to help improve that fat atrophy. Soft tissue fillers have been around for years. There are really only two now presently available that I like. There are many others out there, but there are really only two that I use routinely, I should say. One of them is a hyaluronic acid product. Hyaluronic acid looks like a clear gel. It's made by two different companies, presently anyway. And the advantage of hyaluronic acid is it doesn't need to be skin tested. It's very easy to inject. It flows very nicely. It molds very nicely. And there's no reported problems post-operatively with allergic reactions or other inflammatory conditions. The disadvantage is it doesn't last as long as I'd like, but you know, that's always been a problem with soft tissue fillers, finding one that works really well and lasts a long time. But the hyaluronic acid products are great for patients that want to see plumping of the lip. For patients that have a thin lip or starting to see some of that, those radial lines starting to form in the lip, I prefer the hyaluronic acid products for improving the lip area. Now, the other compound I use quite a bit is not a hyaluronic acid, but it's calcium hydroxyapatite. It looks like this white material. Calcium hydroxyapatite is, again, a natural compound. It's been around for a long time in medicine, but it's only been in the past year or so that it's been FDA approved for facial soft tissue augmentation. I've personally been using it, however, since 2002, since I was part of the company's medical team that was evaluating the product. Now, the advantage of this product is it lasts about a year, maybe even a year and a half, depending on the patient, which is better than almost anything that's been on the market in the past. The other advantage is that it can be used to help patients that have soft tissue atrophy, so patients that have fat atrophy over time. So I use it a lot for patients that are developing deeper folds in their cheeks, developing that hollow look under their eye, patients that are losing a little fat in this area, patients that have a little howling in the jowl area. A lot of those patients might be better off with surgery, but there's some of those patients that don't want to undergo a procedure, and then we do have this alternative that we can offer them. We even call it a 3D facelift, even though it's really kind of not a facelift. It's kind of just trying to hide what happens in the mid-face and jowl area over time. So it's a nice procedure. Patients are very happy with the results, and it is something that can be done in the office. The last filler I want to talk a little bit about is silicone. Liquid injectable silicone is something that should only be used sparingly for cosmetic work, and it has to be used very carefully because it's a permanent filler. But I found if you see a doctor that has mastered what's known as a microdrop technique with silicone, it works extremely well for patients with very small scars, and I use it quite a bit for acne scars and other small scars in the facial area with very good results.